Welcome to our patient education video on distal bicep ruptures, brought to you by Adelaide Shoulder and Upper Limb Clinic. I'm Dr. Oscar Brumby-Rendell, and I'm here to guide you through understanding distal bicep ruptures, normal treatment, and the rehabilitation involved. Let's begin by understanding what happens when you experience a distal bicep rupture. The bicep muscle in your upper arm has two attachment points at the shoulder and one in the forearm. The forearm attachment is the distal attachment. A distal bicep rupture occurs when the tendon attaching the bicep muscle to the forearm bone tears or detaches, usually due to a sudden, forceful movement or repetitive stress on the tendon. Patients often describe either lifting or moving something very heavy and the arm straightens against the heavy load. This is called an eccentric contraction, when the muscle is lengthening but still trying to contract. Okay, moving on to treatment options for distal bicep tears. The approach to treating depends on various factors, but largely concerns the patient's age and activity level. With non-surgical management, which means the tendon will not reattach to the bone, function can still be okay. There will be an approximate 30% loss of bending the elbow strength and 50% loss of turning the forearm to face palm up. This motion is particularly important for tradespeople, for example, turning a screwdriver. Surgical treatment can restore full motion and strength to the elbow. The aim of the procedure is to retrieve the ruptured tendon end and reattach it safely to the bone. First, the tendon end is retrieved and the frayed tendon fibers cleaned up. The tendon stump is then stitched with very strong suture material to get a solid grasp on the tendon stump. Then a socket approximately 8 mm in diameter is half drilled into the bone. The tendon is then pulled down into the socket and held there with a metal button. The bone then grows around the tendon stump, reintegrating the tissue. The procedure is straightforward in principle, but there are many important nerves and arteries that are close to the surgery site and require careful handling of the soft tissues to safely perform the procedure. Finally, let's talk about the rehabilitation process following treatment for a distal biceps rupture. Whether you undergo surgical or non-surgical treatment, rehabilitation plays a crucial role in restoring strength, flexibility, and function to the affected arm. The rehabilitation is broken down into rest and gentle range of motion exercises for the first 6 weeks, followed by removing the elbow sling and full range of motion with light resistance from weeks 6 to 12. After 12 weeks post-surgery, it is usually safe to start training the biceps with resistance training as comfort allows. In general, patients will need to rest the elbow for the first 6 weeks but have a very strong functional outcome following distal biceps repair.
This presentation forms part of the Adelaide Shoulder and Upper Limb Clinic's online educational series. If you would like to view more of our online education materials, please visit our website asulc.com.au.